I'd like to begin our first workshop on neurodiversity in academia. Welcome to our workshop facilitator, Kate All. Kate All is a UKCP registered psychotherapist in Cambridge, UK, with over 20 years experience working with academics, researchers, and writers. First during her career as a book editor in academic publishing, and later as a therapist for staff and faculty at Cambridge University and in private practice. She has a particular interest in neurodivergent experience and runs regular workshops on compassionate productivity for knowledge workers who face challenges in regulating attention, energy, and attention. Thank you, Kate. The virtual stage is yours.
Thank you very much. It's lovely to be here. I was just saying what an honor it is to be part of such an enterprise to help academics talk to each other and explore ways to support their mental health. This is obviously a subject that's very close to my heart and my professional identity. So I'm going to be talking to you today about neurodiversity in academia, and I'm just getting my slides up. If you can bear with me for a moment. There we go. Okay. Oops. So I'm hoping everyone can see that. Good. Okay. I'll start with a disclaimer. Dragonfly Mental Health, on whose behalf I'm presenting this, is not a healthcare provider organization. The information provided today does not qualify as medical advice and does not substitute for speaking to medical professionals. And with that established, let me introduce myself. So I've already been introduced as a therapist who worked at the Cambridge University Staff Counseling Service for many years, and prior to that worked in book publishing with academics. So I'm very familiar with the kinds of difficulties in academic experience in terms of imposter phenomenon, procrastination, perfectionism, the stresses of working in very competitive, under-resourced environments. And I'm going to be talking to you today about neurodiversity in academia. I'll start by talking about what neurodiversity means, the origins of the term, and who might be considered neurodivergent. And then I'm going to talk a little bit about specific neurodivergences and how those tend to manifest in all sorts of ways in academia, in great ways that really sort of nurture the academic community and intellectual endeavor, but also in challenges that will pop up in any sort of environment or any workplace. And I'm going to be talking through some accommodations and suggestions for more inclusive practices in workplaces, and then a discussion afterwards. So I want to say that this is really intended for people who are neurodivergent, who consider themselves to be neurodivergent, whether you have a diagnosis or are self-recognizing, but also for people who are working with neurodivergent colleagues, and all of you will be, whether you realize it or not, I think, or people who know a lot about neurodiversity and people who are really new to the term or need more information about what it means. Neurodiversity is a term that we're hearing a lot at the moment, and I think people sometimes don't necessarily feel comfortable using the terminology or understanding what it might mean for people. So hopefully this will help just to give a broad brushstroke sort of introduction to what neurodiversity is, why it matters in academia, what challenges it brings, as well as what benefits, and how we can all work together in a neurodiversity-informed way to make more welcoming and collaborative workplaces. So what is neurodiversity? The term itself was coined by Judy Singer in 1996, and she drew on the idea of biodiversity. So there is natural variation within a system or a population that supports its adaptability and resilience. So the idea there is that it's just a sort of cognitive variation among a species that will help us to be hardier and weather more different storms and solve different problems, because individuals will have different specializations or different abilities. And the relevant definitions, some of the terminology that we encounter when we talk about neurodiversity, obviously, there is neurodiversity, which is just the variation in neurocognitive functioning within our species. And that doesn't just mean people with particular diagnoses or conditions or identities, but it just means we are all different and we all have different strengths and weaknesses. So neurodiversity on a population level is just that variation, that richness. The term neurodivergent, which I'm abbreviating here ND, and that's a very common abbreviation that you'll see around. It just means having a style of neurocognitive functioning that differs significantly from the dominant societal standards. So it means that it's different, not deficient. But if you think of a sort of bell curve, it's just outside of that curve bit. And what that can mean is that a lot of the assumptions that people make about how things ought to feel or how we should experience things or think about things might not apply in the same way to everyone. And neurodivergent people often report having a feeling of things don't quite work for me the way I'm told they're supposed to work, or I'm told that to expect them to work. And neurotypical, the abbreviation for that is NT, just means having a style of neurocognitive functioning that falls within the dominant societal standards. So you're more likely to have the sort of experience that you see reflected in the media or the people around you. So who is considered neurodivergent? And I want to start by saying, I'll start with the bit of text on the bottom of my slide, which is these are descriptive diagnoses. And that means that they're based on self-reported experiences and third-party observations. So you can't get a blood test that will tell you whether you're autistic, for example. It's to do with your reported experience of your life and corroboration from people who have known you throughout the lifespan. It's not uncommon for one person to meet criteria for several neurodivergent conditions. And one way of thinking about this really is that each condition, each diagnosis is a symptom picture or a picture of traits, a picture of tendencies or attributes. And what we will find is that because these are spectrum or constellation conditions, that there's a lot of overlap between different diagnoses, different terms, different symptom pictures. So it's not uncommon for one individual to meet criteria for several, but also they're not hard and fast categories. So it's just worth bearing that in mind as we go through this talk. And you'll notice that in this talk, I focus quite a lot on autism, but I will try to bring out every time the traits that are encompassed within autism that can also feature in other neurodivergent conditions. So who is considered neurodivergent? People who have a diagnosis of autistic spectrum disorder or autistic spectrum conditions, as it's also called. People with ADHD, otherwise known as ADD, so that's attention deficit hyperactivity disorder or attention deficit disorder. People with specific learning difficulties, such as dyslexia and dyscalculia. And people with developmental coordination disorder, which is also known as dyspraxia. And it's worth mentioning that within the umbrella term of neurodivergence, some people also consider many mental health conditions to be neurodivergent. So some people consider themselves neurodivergent if they have generalized anxiety disorder or panic disorder or schizophrenia or any of the conditions that are known as personality disorders, if it's underpinned by a sort of hypersensitivity or hyposensitivity of the nervous system, many people will consider themselves to fall under that neurodivergent umbrella. So preferred language. And I think it's worth really thinking about this because many identities will prefer a person-first language, whereas, and it's not true for everyone, but a large part of the neurodivergent community online do prefer identity-first language. So autistic people rather than people with autism. And I think this is just important to stress because it kind of goes the other way around from a lot of the preferred language we're used to thinking of. But a lot of people will prefer to be called I'm an autistic person rather than a person with autism. There are terms, the term Asperger syndrome, that was a diagnosis up until about the late 90s, that referred to what is known in the UK as high functioning autism or level 1 autism. And people who are diagnosed sort of up until that point might consider themselves to have Asperger syndrome or identify as Aspie. But there is a feeling among lots of people that these are outdated terms and they may cause offense because of the connections to Hans Asperger himself and his some of his views. So instead of specifying levels of functioning, so high functioning versus low functioning, when we're talking about people, it's important to identify specific support needs. High functioning and low functioning doesn't really tell us anything about how we can help someone or interact with them helpfully. So identifying what they need, what their sensory needs are, what their social needs are, is preferred to putting a label on it of high or low. And finally, if someone does not communicate using their voice, specify how they do communicate. So that might be through assisted communication technology, for example. And so why is neurodiversity in academia important in particular? Why is it important to think about this? And I think anyone who does advanced study is already an outlier compared to the general population. Anyone who's in academia is unusually able to recognize, analyze, and process patterns of information, unusually able to focus deeply on a topic or a problem, and interested to an unusual degree of intensity. And when I say unusual here, there's no value judgment in that. It just literally means it's a rare ability. It's a rare degree of intensity of interest. And I think we can all agree that these qualities are not just valuable, but necessary in research and education. You can't really have research and education without these attributes, these qualities. And I have looked and looked high and low to find a sort of prevalence, sort of numbers to see what percentage of people in academia are neurodivergent, consider themselves to be neurodivergent, have diagnoses, and that information is just not available and not studied widely enough. But what I will say is that when I worked in the staff counseling service at Cambridge University, we began to issue to all of our clients who came in the AQ25, which is a very short, very basic screening questionnaire for autistic traits. And we found that roughly 25% of everyone who came for counseling sort of met criteria for some autistic traits. So I think it's fair to say that that this is something that is affecting a lot of people in academia. And we know this on a common sense level, that if you're a researcher, you have a problem-solving mind, you think about things a bit differently. So when we think about supporting a neurodiverse workforce, unusual cognitive abilities often come with significant differences in neurological functioning in the areas of emotional regulation, so that's sort of mood, communication and sociability, movement, sensory processing, so experiencing the sensory world around us, attention, and perception of space and time. And these differences can come with a higher risk of anxiety and depression, OCD and eating disorders, stress-related physical health problems, and burnout. And so what this slide is really trying to sort of say is that we have this richly diverse neurodiverse workforce. We have these people with these sort of incredible minds who can do incredible things. But then there are also sort of issues that make it a bit harder to live in the world, really. To live in a social world and to feel comfortable in the sorts of social situations that workplaces put us in. And that's where it's important to think about mental health in the context of work and in the context of neurodiversity generally. Some common areas of challenge and sensitivity for academics who are neurodivergent are inflexibility and adaptability. And again, when I'm talking about neurodivergent people, I'm talking about people not just autistic, not just ADHD, but people who are outliers cognitively and in terms of their nervous system. So flexibility and adaptability can be an area of challenge one way or the other. So it might be that someone is very flexible to the point where it's actually quite difficult to sort of pin things down, or they might really have difficulty with changing plans and with adapting to new information. There can be challenges with perception of time. And again, it can go one way or the other. It can be that someone is time blind, that they don't really have an internal sense of how long 5 minutes is and how long 2 hours is, and time gets away from them. Or it could be that there is a very precise kind of internal sense of time that can lead to real distress if things fall out of schedule, if something runs late. Orientation to routine. It's the same sort of thing. There can be a difficulty in deviating from a routine, but there can also be difficulty in setting up a routine, following a routine, sticking to it. Social communication can be a problem for people who are neurodivergent. And I think social communication is the challenge and the difference that we're most aware of in terms of popular cultural representations of neurodivergent folks. But social communication can be anything from reading nonverbal cues and body language, understanding turn taking, but also just feeling quite overwhelmed by social interactions, by groups, being very empathic, feeling permeable to others' feelings is something that is a very common facet of neurodivergent experience. Sensory processing is a big one. So being very sensitive to sounds, textures, light, smells, the physical environment can be perceived very, very differently for people whose nervous systems are put together differently. Receptive language processing is one that I don't think is really recognized enough, which is that it can take longer to really take in spoken language and understand it and process it and respond to it. And that can lead to real difficulties in public speaking or participating in groups where there's a lot of kind of on-the-spot interaction. And this can also be perceived sometimes as shyness or social anxiety when actually it's just needing a bit more time to take everything in and respond. Organizing thoughts and words can be very difficult. Sort of deciding where to start and how to organize an argument or a piece of text can be quite daunting. And that also leads into planning, sequencing, and organizing. And again, it can be an issue for people where things need to be planned and need to be organized and need to go in a specific order. Or people can experience things on sort of the other end of the spectrum where it's very difficult to plan and it's hard to know what order things should go in and how to organize things. And what these challenges can look like from the outside, if we don't recognize that they're underpinned by genuine cognitive and nervous system differences, is it can look like rigidity or difficulty collaborating. It can look like shutdown or meltdown when faced with ambiguity or uncertainty that people might think is an overreaction. It can look like perfectionism and over control. It can look like communication that might be experienced as impolite or unfriendly. So people can unwittingly give the impression that they don't want to make connections with other people when actually they do. There's just a sort of difficulty in giving and receiving those messages. It can look like difficulty presenting or speaking in groups, sensitivity to perceived criticism, and lack of consideration for time boundaries and shared environment. And again, this is a very common misunderstanding of people who have executive function difficulties. We might say this person doesn't respect my time, or they're disrespecting the environment, when actually, in my experience working with so many neurodivergent people over the years, they're desperate to not come across this way, and desperate to get along and to be respectful and to be sort of on time and organized. And it's just that there is a real difficulty that can be mitigated by some sort of environmental changes. So just bearing this in mind, in a neurodiverse workforce, it's always helpful to remember that people do well when they can. Everyone wants to get along. Everyone wants to be a good colleague. If there is some sort of difficulty in interaction or behavior, it's always worth saying, what is this feeling like for you? Is there a way we can support you? What feels difficult about this for you? So finding the right support and accommodation is key. And a lot of these difficulties can be mitigated really successfully if people work together on the environment. Just a note about language and identity. And this can be a tricky one, I think, for neurotypical people who aren't sort of steeped in the language of neurodiversity. Is how do people understand their neurodiversity? And this is going to vary enormously from person to person. So people will understand their neurodivergence according to how it affects them in their physical and their social environment, and according to how it's affected their self-concept. You know, how it feeds into how they see themselves. So some people are going to require significant support to live independently and may consider themselves disabled. Some might consider themselves disabled without having significant external support needs. And in various different countries, the regulations will differ about this, but certainly in the UK, you're protected under the Disability Act with a neurodivergent diagnosis. Nonetheless, some people do not consider themselves disabled, even if by law they would be entitled to. Some identify as neurodivergent and have chosen not to seek a diagnosis. And some, whether they have a diagnosis or are self-recognizing, choose not to disclose this aspect of their identity. And this is all just down to sort of personal preference. So it's just worth noticing that there's no way anyone has to identify or disclose about this aspect of their identity. And I've talked a little bit about co-occurring neurodivergences and the overlap between neurodivergent conditions. And one thing I just want to raise is that very often people with ADHD or with a mental health diagnosis such as OCD, and also any personality disorder diagnoses, may have subclinical autistic traits falling within the broad autism phenotype. Which is just a way of saying that people with various other diagnoses may have a lot of autistic traits, a lot of things in common with people who have an autism diagnosis. And so it's always worth considering whether accommodations that are commonly offered to autistic people might also be helpful for someone with a different issue or a different diagnosis, even in the absence of an autistic spectrum conditions diagnosis. very often people with OCD, people with personality disorder diagnoses have similar sensory processing difficulties and similar social communication differences. So it's really worth sort of always thinking about neurodivergent accommodations and how they might benefit people who you might not immediately imagine to be neurodivergent or think of in that way. So I'm going to talk a little bit now about autism first on our whistle-stop tour of neurodivergent conditions. So this is the condition we probably hear most about or know most about, and have varying degrees of sort of understanding of. Autism, otherwise known as autistic spectrum disorder or autistic spectrum conditions, and the broad autism phenotype, is a constellation of significant lifelong differences in social communication, sensory processing, language and information processing, and nervous system regulation. So it's a spectrum condition, but it's important to recognize that that doesn't mean that there's sort of mild on one end and severe on the other end. That is a very common misconception, that people will have varying support needs, definitely, but that because there are all of these different areas of cognition and experience that are affected, you might have one autistic person who really doesn't, who doesn't feel very different from other people in terms of social communication, but who really feels very different in terms of sensory processing, has a very different experience of the physical environment. You might have someone who is a very quick language processor, but who has difficulties with nervous system regulation. So it's much more of a pick and mix. It's much more of a constellation than a spectrum. People will have traits that manifest in all sorts of different ways. And something that I find really helpful when thinking about autism, when you think that it is this descriptive diagnosis that takes into consideration all sorts of different areas of cognitive functioning. This little infographic from Bernard Crespi's 2021 paper, Pattern Unifies Autism, I find really helpful. And it focuses on this idea of pattern being the underlying sort of theme that brings together a lot of the behaviors and experiences of autistic people. So there's pattern maintenance, which will manifest in a sort of a desire for repetition and sameness and a high reactivity to novelty, not really enjoying when plans change, liking for things to be routine or predictable. Pattern recognition means that very often autistic people are very good at seeing patterns within sort of visual patterns particularly, but recognizing a pattern in information, in data, in music, in sound, in speech. Pattern perception can manifest in sensory hypersensitivity and high sensory acuity. Something like perfect pitch might fall into that. Pattern processing can manifest in highly deliberative cognition, which means that you're thinking from a point of view of sort of beliefs and principles and rules and theories rather than a gut instinct or an intuition. Hyperlexia, sort of being very, very verbal. High fluid intelligence, being able to bring in lots of different mental models of things and take into account information across loads of different modalities. Pattern seeking, which manifests in a high drive towards systematizing, classifying, categorizing. An interest in STEM disciplines, but not just STEM disciplines, because that's another big assumption about autism. And a high explanatory drive. So a real curiosity about why is this happening? And finally, pattern generation, which can manifest in repetitive behaviors and thoughts. And we can see from all of this, it's really clear why this focus on pattern just lends itself so well to research and to intellectual endeavor. But you can also see how it can make some aspects of everyday life a bit difficult. I'm thinking particularly from my point of view as a therapist of the pattern generation bit, the repetitive behaviors and thoughts. And this can be a real burden for people with problem-solving minds, is how do you turn your mind off to go to sleep? How do you get it to stop trying to solve problems and going over things? So autism and masking, it's really important when we think about autism and mental health and autism in social environments like workplaces to consider this idea of masking, which is the use of social compensation strategies to fit in with neurotypical norms. So this might be, for example, imitating how other people behave or learning social scripts so that you don't have to rely on your receptive language processing. You don't have to rely on that ability to sort of think and improvise on the spot. Creating mental algorithms to determine how to behave socially. And this is really cognitively taxing. If you have to think very hard about, are you saying the right thing? Are you mirroring this person's body language? If that is something that you need to think very hard about and make deliberate decisions about all the time, that's exhausting. And neurodivergent people often require a lot of recovery time after social activity and are susceptible to social burnout and to burnout in general if this is something that is asked of them a lot. And something to add to this is that autism is vastly underrecognized and underdiagnosed in girls and women, in part because girls and women are more socially conditioned to mask, to conform, to fit in. And get less social reward from being different and individual and standing out. And so it's often not picked up as young as it is for boys. If someone is having sort of difficulties at school, for example. Another reason it's underrecognized and underdiagnosed in girls and women is that originally it was thought that only boys and men could be autistic. And it's only very recently that we've begun to rethink the diagnostic questionnaires so that they take into consideration a more female presentation of autism. So I think the prevalence has been estimated as, I think it was 4-to-1 male to female, but now Francesca Happe, who is one of the predominant researchers in autism in women, believes that it's much closer to 50-50, that the autistic population is sort of 50% male, 50% female, but that women are underdiagnosed. So I'm talking here about autism and mental health in terms of how we can support mental health among autistic people in the workplace, but also things that might be helpful outside of the workplace in terms of mental health support in general. So some key things to bear in mind about accessing mental health support when you're autistic is that very often, and this isn't just for autistic people, this is for neurodivergent people more generally, there's a difficulty with emotional recognition. There's a condition called alexithymia, which means a difficulty in recognizing your emotional experience and putting words to it. So this can mean that it's difficult to know what you're feeling and whether it's a physical feeling or an emotional feeling, what's causing it, where it's coming from. And that can mean that it's really difficult to know what kind of support you want or need. Very often, neurodivergent people will have an impaired ability to recall life events. So this is something that is known as severely deficient autobiographical memory, which means that you might have a fantastic recall for facts that are related to your particular area of expertise or interest, but it can be very difficult to retrieve memories that are contextual to your life. So conversations you've had or life events. And for a traditional talking therapy where they'll say, tell me about your childhood, that makes it really difficult for someone to engage with. If you don't know where to start talking about that and you can't retrieve the memories and you can't work out which memories would be most important to talk about. So very often neurodivergent people do unfortunately have a kind of frustrating experience of a traditional talking therapy setup. Um, and that's something to bear in mind. It's really important to, if you are self-recognizing as neurodivergent, to seek out a practitioner who can understand some of those presentations. A broader range of events can trigger PTSD in autistic people because of a sort of nervous system sensitivity. That means that that there are more sensory experiences, more social experiences that feel really aversive and really traumatizing and really confusing. So what has been discovered recently in research, again by Francesca Happe, is that events that would not normally be considered to be inherently traumatizing can result in PTSD for neurodivergent people. So this is really something to bear in mind, that some of the everyday stressors of working life might actually be landing in a much more debilitating way on neurodivergent colleagues. And that, this can result in PTSD, and specific support will be needed. Another factor in PTSD for autistic people is that sometimes having difficulties interpreting social interactions can increase vulnerability to abuse and exploitation. So often, sadly, people who have some social communication difficulties might find themselves suffering more traumatic events at the hands of others. Autism is prevalent in eating disorder patient populations. And this is a really important thing to think about in terms of seeking treatment. It's really important to let your practitioner know if you are autistic, because chances are there will be different mechanisms underlying the eating disorder. It won't necessarily be a focus on body image or size or weight, but it will be more to do with sensory issues and control and predictability issues. And finally, the stresses of everyday life are a major contributor to poor mental health for autistic people. And this is something that I think is not often recognized among mental health professionals who do not specifically work with a neurodivergent client population. That the stresses of everyday life can be, frankly, outright traumatic. So what helps? What can we do to support mental health, good mental health in an autistic population? And the top one really is environmental accommodations to manage sensory stressors. So soundproofing and privacy and insulation from smells and things like this, managing the light in the environment. Occupational therapy and mind-body interventions that support nervous system regulation can often be more helpful than talking therapies for all the reasons I just laid out in the last slide. Working on cultivating a feeling of safety in your body and in your nervous system can sometimes give you a better foundation than trying to retrieve memories that are difficult to retrieve. CBT, that's cognitive behavior therapy, DBT, which is dialectical behavior therapy, and other manualized therapies can be helpful if they are adapted specifically for autism. And again, that's because some of the perpetuating factors of emotional distress are different for autistic people than the assumptions that are often made, the neurotypical assumptions that are made in these manualized therapies. And as I said before, for eating disorders, seek evaluation for ARFID, which is avoidant restrictive food intake disorder, and work with a practitioner who specializes in autistic presentations. So common difficulties for autistic academics in the context of an academic workplace. Autistic people are likely to face sensory and social overwhelm, social anxiety. Uncertainty, changes of plan, and lack of clarity can be very distressing, as can inefficient or unclear processes. Organizing and processing information in words can take longer and be more arduous. And this ties in with speed of information processing and struggling on the spot to answer questions. Heightened sensitivity to perceived criticism and boy, is there a lot of criticism anyway in academia, right? So it's very tough to feel particularly vulnerable to that. And difficulty with indirect or nonverbal communication. Some helpful workplace accommodations are flexible work organization. So flexi time and, sort of remote working where possible. The option of having subtitles on and cameras off during video meetings. Communicating the why when assigning tasks. So that goes back to the pattern unifying autism slide and the high explanatory drive. It's really important to know why you're being asked to do something. Less hierarchy at the workplace so that there's more of a feeling of agency and autonomy. I realize there's not a whole lot, all of us can do about this, but as a principle to work towards. Consider sensory needs. So again, lighting, smell, sounds. Give information in advance where possible. So that means meeting agendas, interview formats, and questions beforehand so that someone has time to prepare a social script, to know what is going to be expected, and to have to rely less on that in the moment language processing and on the spot communication. So on to ADHD or ADD, which is attention deficit hyperactivity disorder or attention deficit disorder, which is characterized by difficulties regulating energy, attention, emotion, and impulse, difficulties with planning and sequencing, perception of time, working memory, and some social and communication differences. And all of the planning and sequencing and time and working memory bundled together is what we call executive function. And there are types within this. There's the inattentive type, which used to be known as ADD, which is distracted from within. Daydreaming is the sort of stereotype of someone with inattentive ADD, very focused on their own thoughts, and finds it difficult sometimes to sort of engage with the task at hand. Then there's also hyperactive type ADHD, where the distractions are not internal so much as external. It's very difficult to filter out information, and the external world is very stimulating and distracting. And someone with hyperactive type ADHD will have difficulties with impulse inhibition and excessive energy, which sounds like a good thing, but can be experienced as really quite distressing. And you can also have combined type, where you have traits of both inattentive and hyperactive ADHD. Oops. It often co-occurs with autistic spectrum conditions. And some people who have autism and ADHD will call themselves ADHD. And it's estimated about 50% of people, or autistic people, also have an ADHD diagnosis or would meet criteria for ADHD. In terms of ADHD and mental health, a lot of the same things apply to ADHD as did to autism. There's the things that are sort of particular to ADHD. You may have heard of the term rejection sensitivity dysphoria, which is something that happens for a lot of neurodivergent people. This heightened sensitivity to perceived criticism. And it's thought that where this comes from in ADHD is excessive discipline and criticism for behaviors in childhood. So a child who was considered to be disruptive or lazy or hyperactive and was criticized and corrected for it a lot, this can lead to a real sense of low self-esteem and an anticipation of rejection in adulthood. Difficulties with working memory and executive function also cause feelings of internal chaos and anxiety. So very often people with ADHD will really struggle with this feeling of kind of being lost in space and time and feeling very, very anxious about that. Medications prescribed for ADHD can alleviate anxiety, and it's normally stimulant medications, so central nervous system stimulants, but it can also exacerbate anxiety. So it may take some time for someone who is on medication to find a dosage and a particular medication that relieves the symptoms without adverse side effects. And what helps? Having a diagnosis really helps a lot of people with ADHD because they can stop trying hard to do things that have always been extra difficult for them, and they can focus instead on mitigating symptoms, finding workarounds, finding supports that will help them to just sort of focus on the things that they want to do without being really, really bogged down in all of the stuff that feels chaotic internally. For many people, the right medication, stimulant or non-stimulant, helps with executive function, sleep, anxiety reduction, and mood stabilization. Coaching can be really helpful in terms of forming habits and routines, and physical activity is particularly helpful in regulating mood and energy and sort of just getting rid of some of that nervous energy. People with ADHD may need more nervous system scaffolding, which means may need to co-regulate with another person, to sort of lean on someone else's nervous system a bit. So techniques such as body doubling, where you have company while executing tasks in a structured time frame, can really help with anxiety, procrastination, and demand avoidance. And demand avoidance is that awful feeling when you know you have to do something and it's like a handbrake comes on in your nervous system and you just can't get past it. And that's something that a lot of neurodivergent people experience. Common difficulties in academia for people with ADHD: persisting with non-preferred tasks. There's a phrase around at the moment of the interest-based nervous system as something that neurodivergent people share, that interest and deep interest in something really drives a lot of your motivation. For someone with ADHD, it can be very difficult to do something that is non-preferred task. Something that feels boring or unstimulating can be nearly impossible. Regulating the intensity of attention, so being unable to focus or unable to stop focusing on something. Executive function, working memory. Estimating how long a task will take can lead people to overcommitting, which is a very common problem in academia. The sensitivity to perceived criticism, interrupting and difficulty listening, so those social communication differences, and also a strong drive for novelty, which can mean that things feel boring quite quickly, that you're always wanting to change things and do something different, and it can be experienced as restlessness. Helpful workplace accommodations, flexible work organization again, subtitles on and cameras off in meetings where possible, or for that to be an option. More frequent one-on-one meetings with your supervisor, just to have that sense of nervous system scaffolding, but also containment and organization, clear deadlines and frequent reminders, and extra support and automation with admin tasks. And as with autism, consider sensory needs, consider environments that have as little distraction as possible. And I just want to say a few words about specific learning difficulties in academia, because there's a real lack of awareness of the prevalence of specific learning difficulties among people with high IQs. We have this idea that if you're intelligent, and you don't have any difficulties or any things you struggle with. Whereas for most people in academia, there's a sort of spiky skill profile where there might be really unusual intellectual gifts in some areas and some challenges that are also unusual. So academics with specific learning difficulties may need extra time and support with day-to-day tasks, and they also may experience a lot of shame about their areas of difficulty. So they might be particularly vulnerable to imposter phenomenon and depression and anxiety. So some specific learning difficulties that you may encounter are dyspraxia, which are difficulties with gross and fine motor coordination, executive function, planning and sequencing, clear speech, and spatial awareness. And this often co-occurs with ADHD and ASD. Dyscalculia is difficulties with arithmetic, time and sequence, musical concepts and reading music, spatial orientation, and interpreting signs and symbols. And dyslexia, which I think is the one that most of us know most about, difficulties reading or writing with speed, organizing thoughts in words and on paper, and understanding text at first reading, skim reading, and spelling. Helpful workplace accommodations for specific learning difficulties are support with or delegation of tasks that pose specific difficulty. Subtitles, again, for online meetings, recordings of online meetings to be made available afterwards, and information presented visually where possible. And just a reminder that highly intelligent does not mean evenly skilled, and being unusually intellectually gifted often goes hand in hand with some deficits in some everyday life skills. So just a reminder of what neurodivergent people bring to university life. There's the systems thinking that we looked at in that slide about pattern unifying autism, the ability to look at a system or a process, to identify patterns, to look at ways things could be more efficient or perfected. There's a creative outside the box thinking, this fluid intelligence that's able to bring in concepts from all sorts of different realms of knowledge. There's the power of hyperfocus, the real intensity of interest and focus on a problem, and the determination of problem solving that neurodivergent people often bring. And then there's a commitment to justice and fairness. And this harks back to that deliberative cognition, this referring back always to ethics, to principles, to morals, and to prioritize that over your own self-interest and maybe your own sort of emotional state. This is something that comes up quite a lot when we think about autistic strengths in particular, but neurodivergent strengths in general. So there is so much that neurodivergent people and that neurodiversity generally sort of brings to university life that it couldn't do without. So it's so important in that respect to just make sure that everyone is given the environment that will allow them to thrive. So that might look like providing networking opportunities outside of large group in-person situations, so that someone who has some social communication challenges can still make helpful research contacts and business contacts and things like that. Clarity where possible about job descriptions and processes. Access to quiet private working space or working from home where possible. Really recognizing and considering shutdown or meltdown as nervous system difficulty rather than what it's often misinterpreted as, which is manipulative behavior. Consider that if someone is withdrawing after a difficult conversation, they're not giving you the silent treatment, but they're processing, they're taking it in, processing and thinking about it, and we'll come back when they're able to. Provide information visually as much as possible. Provide a menu of helpful accommodations, and this is a really important one. Very often in my work, when I worked with clients at Cambridge University, people would want to know what accommodations were possible, what could help them more in the workplace. But it was too hard to think about what those might be, what might be what the university might be able to offer. So it can be so helpful if HR or if a department head can say, here are some of the things that we could do to help with, this particular set of difficulties. Can we go through them together so that you're not putting the onus on the person to create the accommodations they need? And regular meetings to discuss difficulties related to neurodivergence and to be able to be open about it without shame or stigma. And hopefully talks like this and conversations like this will really help with that. So there are loads of books. I mean, we're in a wonderful time at the moment where there's just so much information coming out about neurodivergent experience. So there's loads to explore. But here are a couple of great books about neurodiversity at work and education. And then these are just some recent and classic books on just the experience, the lived experience of ADHD and autistic spectrum conditions, Asperger's syndrome as was. It's now sort of within the umbrella of autistic spectrum conditions. And then there's the Neurodiversity Network and the Neurodiversity Hub, which are sort of particularly for neurodivergent academics. And I think it's wonderful that there are more and more supports like this for people that are genuinely accessible and understanding. So thus concludes my whistle-stop tour of neurodiversity in academia. It has been a pleasure to speak with you. And this has been an introduction. It hasn't been completely exhaustive or coherent, but it's hopefully just a way in to think about these things and to think about how to work with each other and bring out the best in each other. So let's open it up for discussion. Okay, Sasha?
Hello, Kate. Thank you so much for an incredible talk. I'm one of the organizers, and I haven't been able to be on time because I also have ADHD. I was wondering something that I guess I've seen in some like recent research literature, but also like I think there is some of the experiences that I can relate to specifically for females, neurodivergent females. There seems to be a very big overlap with premenstrual dysphoric disorder. So disorders of hormonal changes. So, and I kind of wanted to ask from the perspective of accommodations. So not only you have your basic neurodiversity, basic, like obviously it's a lot already, right? But also like you have these cyclical changes that make it even more difficult. Like how can we like also start talking about those things?
Yes, and this is such an important question. You know, we think also about the discourse that's sort of happening finally now in the UK around sort of menopause and other things like this, and women's health more generally, and how can we sort of make workplaces more female friendly? And I would be really interested to hear. I mean, to hear what. I mean, maybe you don't want to share this in the context of a conference, but what would feel most supportive to you? Because I think it's one of those things where there's still so much sort of stigma and taboo around sort of talking about these things generally, that what is supportive to one person might feel really intrusive to someone else, or might feel really sort of difficult to someone else. So I'm not really answering your question in a very direct way, but I think that I think that it's, I think that the issue you raise about this, the overlap of, or the influence of sort of female hormones and cyclical sort of hormonal events on neurodivergence is really sort of really relevant and really interesting. I know that there's quite a lot of correlation between sort of estrogen levels and dopamine levels and ADHD presentations generally. I know that very often people's stimulant medication stops working when they're menstruating. So I think there are all sorts of things, and I'm not a scientist, as you can probably tell, but when I'm talking about this, I'm a sort of therapist rather than a scientist. But I think also what you're saying points to this fact that we have an assumption, this neurotypical assumption that doesn't even work for sort of, you know, neurotypical people, that we're all always the same. We're all always going to be functioning at the same level. If we're capable of something, we're always capable of it. And I do think that we need to find ways to design workplaces that recognize that we have fluctuations in our capacity and our mood. Everyone does, you know, regardless of neurotype, gender, sex, what have you.
Thank you so much.
Well, yeah, thank you. Any other questions?
There are a few questions in the chat.
Oh, in the chat. Okay, hang on, wait a minute. I've got a. There we are.
There's also an anonymous question in the Q&A box. You can
okay.
read out if you don't see it.
How to approach the topic of ADHD diagnosis with research supervisor. This is a really, really tricky one, isn't it? This is, and I think it's a really difficult one because it really depends on what your relationship with your supervisor is, what your institution's HR policy is. I always think it's really helpful to think about what outcome you want from a particular conversation like this. What are your goals? What do you want to happen as a result of this? Okay. I've got a question that says, how does something like post-concussion syndrome fit with neurodiversity? The symptoms are similar. Okay. Sensitivity to sound and light, difficulty finding words, slower processing speed, etc. And I think that would actually fall under the heading acquired neurodivergence. So something that hasn't been lifelong, but affects someone in those similar spheres would be considered to be acquired neurodivergence. Okay. Just looking in the chat. Oh gosh, I've got loads of questions, don't we? How can employers navigate accountability and completion of deliverables with an employee with ADHD? And this is a really difficult one. And I think I would have to say, in the same way that you would navigate this with anyone, with any kind of extenuating circumstances. Workplaces are set up as though we are machines and we don't have a sort of life outside that's going to impact our work. I think in terms of navigating accountability and completion of deliverables, I think it's really important to be able to talk openly with an employee about what do you need in order to support your work, what would be helpful for you in terms of an interaction style, in terms of admin support, in terms of meetings. How much containment, how much management do you want? And just keep an open conversation to think about how you can help them to meet those deliverables. Okay. Do you have suggestions on how to accommodate people with various conditions during exam situations, while realistically sticking to objective criteria and trying to give comparable conditions to all students? I'm going to have to pass on that one, because as a therapist, I think I'm probably, I don't have the right sort of organizational experience really to be able to advise on that. But I would say that's something to take up with a disability officer and see if they have any ideas. Okay. I'm just scrolling down to see if I've missed anything. Have I missed anyone's questions? I think that's all I can see. Oops. I don't know if I've just done something strange. No. Okay, that's all I can see. If anyone has any questions that they want to email me afterwards, feel free to. It's just kateall@gmail.com. So thank you so much for all of your great questions and great chat.